Good afternoon, everyone, and a very warm welcome to this webinar. This webinar is organised by the Royal Society of Edinburgh, which is Scotland's national academy, whose mission is to advance learning and to make knowledge useful. This webinar is the first of a new series of events around artificial intelligence. These discussions will highlight the impact of artificial intelligence on society, and they will be live streamed on Zoom each Tuesday, and this is the first of 4. It starts at 2 p.m. and lasts for 30 minutes. The first talk of the series is going to be given by Pooja Jain, who is the CEO and founder of CogniHealth, and she will be talking about reassessing the role of digital technology in social care. My name is Marion Scott, and I'm a professor in statistics at the University of Glasgow, and I will be chairing the event. Before we get underway, just to remind people that Pooja will give a short 10-minute talk before leading on to a live Q&A session that will last approximately 20 minutes. And you should be able to access the question and answer button, for want of a better word, on your screen where you can post any questions that you might have. You can submit them at any time and we'll pick them up after Pooja's talk. You should also be aware that the event is being recorded and being live streamed to YouTube. So a warm welcome to everyone, and especially to our guest speaker this afternoon, Pooja. So I'd like to invite you to give your presentation. Thank you.
Thank you for the introduction, Marianne. Good afternoon, everyone, and thank you for joining in today's session on AI in social care. So artificial intelligence is increasingly present in our day-to-day lives, whether we're ordering a cab from our smartphone or talking to our bank via chatbot, or taking up Netflix recommendation of what to watch next. And as these algorithms become more finely tuned, AI will be able to make more informed and valuable contributions to the way that we live, work, and relax. So my focus for the next 10 minutes is on AI in social care, a sector that has been slow and resistant in its adoption of such solutions when it compared to other sectors like retail or banking. I'll be exploring what is the role of AI in social care, where does it truly fit, and how is the sector maturing in its adoption of AI-based technologies, especially given the pandemic. This situation has not only helped shine a light on both the practical added value and limitations of AI, but actually people using it and not just talking about it. So I'd like to start by saying that when we have a discussion about AI and technology, it's really not about the technology or the algorithms, but it's about people. It's about you and me. So the first reason that I think that social care is so behind in its adoption and so resistant of technology and AI-driven solutions is because there's this fear that technology will take away from the human element that is so vital in providing and receiving care. They'll replace jobs, it'll isolate people. But for a second, if we start reassessing the role in where it's an enabler of human connection, then I think the acceptance and adoption will change. And we're already seeing that throughout the pandemic. For example, there are a lot of dementia-friendly organizations and charities that are hosting group sessions like Tea and Jam over Zoom, and it gives people affected by dementia and their family a chance to just grab a cup of tea and chat with others. It's amazing and impactful, and it's the current situation that has pushed the adoption of that. And I hope to see that this continues even beyond the pandemic, where it's a complementary to the physical meetups for people who live far away or can't attend for that week. So one of the big factors of technology is its acceptance and adoption, and that really comes down to human behavior. The second reason, when we start looking specifically at AI-based technology, is the availability of bigger, higher quality open data sets and accessing it and using it in a secure manner. And in a sector like social care, even a lot of the data is not in a digital format at the moment. So you can imagine how difficult it would be to use things like machine learning. So with that said, I'm going to discuss 3 solutions in how they're perceived and how their adoption is changing given the current situation that we're in. So COVID-19, the lockdown, social distancing, all of these things can trigger anxiety, stress, or worsen any pre-existing mental health issues for a lot of people. And I think because of this, we're seeing more and more people turning to meditation and mindful apps as a way of feeling calm in the midst of the pandemic. Once, which was kind of a niche area, meditation and mindful apps like Headspace, Calm, and 10% Happier have seen a huge increase in users. There were about 75,000 more downloads at the end of March when we compare it to earlier this year in January. It's gotten so much attention by the local government. And so people will argue, why introduce a technology in an activity that you would do alone? But in a time where isolation is such a big thing, people are using, for example, the Headspace community as a way to feel together, to connect to other people, even if it's just virtual. It's because people are craving human connection and wanting to share stories. And so for two reasons, whether it's just to get started with meditation to bring that peace, or knowing that while they're doing that activity, they're actually part of a bigger community who are in a similar situation as they are. And you'll find that the theme of social connections runs through a lot of what I say today. And now Headspace are using machine learning to bring a conversational experience to the app, essentially using it to coach people to instill healthy habits and help people build a routine in a time of disturbance. So it gives the user the chance to ask questions, ensure that they're doing things the right way, and hopefully take a little pressure and stress off the current system, and it acts as a good complementary mechanism. The second part of the solution that I wanted to highlight is how it's managed to integrate itself into the health and social care system. It's so difficult to ask any startup, SME, really any private organization that wants to integrate their solution within the system. It's a really lengthy process. So even the apps that self-management apps that come out of NHS have had difficulty with adoption. But I think that's really changing, and it'll be interesting to see if people continue to use self-management apps and if they continue to push the system to keep adopting these solutions at the same pace as that we do today. And the second product that I want to talk to you about is virtual assistants. So people are using voice assistants more than ever, going into the pandemic than they were a few months ago. They are using to bring education and preventative care around COVID-19 to people. So for example, Carrie is a English and Welsh speaking virtual assistant from IBM Watson, and they aim to provide information to common COVID-19 questions. Now, the solutions provide natural language processing capabilities and AI to really understand what the user is asking and being able to respond to the common questions. And so this is really important as another kind of medium or an access point for people to get this information, especially those who are older adults and people living with healthcare challenges. Using the power of voice enables them to also communicate with their relatives and friends a lot easier. It's a good source of entertainment, and really it's creating a more human experience. It helps people maintain a routine. They're cost effective when compared to a laptop or a smartphone. And they can be coupled with Internet of Things. They can detect, if, for example, the fridge is running low on food and needs restocking, as negligence is a huge challenge in the social care space. So we can see that obviously virtual assistants have so many benefits to people, and it's versatile and adaptive. It just needed kind of that starting point of human behavior to adopt it, to use it for 2-3 features, and then that helps kind of give them access to more of its functionality and the benefits that it can provide. The last challenge that I kind of want to talk about is the use of assistive robots to support carers, especially given the kind of high turnover of staff shortages, social distancing for family carers. It all just means that people who need care aren't getting access to it. And now talking about assistive robots, it's kind of controversial and people have strong opinions on this. But what if we take, assistive robots that can do the physical tasks? And if they come and do this, then that leaves family and professional carers more quality time with the person with dementia or whoever their client may be. And if robots kind of come into this kind of care process, then maybe that gives us a conversation to talk about where it's not so controversial. So the challenges of social care that I've kind of highlighted have always been there, but the pandemic has sort of surfaced them and forced us to do something about it. These technologies aren't new. Again, it's existed for a while, but the behaviors weren't there to support people to do it. And now they've started using some of these digital tools and, kind of having the mind frame of that wasn't as bad as I thought it was going to be. And so it gives us kind of a path to start introducing these digital solutions within the social care sector. So it's really not about how do we replace analog with digital. It's about leveraging the power of technology that augments the most humanistic aspects of care. It's about empowering people to make informed decisions. It's about helping people to stay in their own homes for longer. It's about keeping them safe. And so I think we're heading towards a blend of virtual and physical care as long as people's behavior and acceptance towards these technologies continue as we come out of kind of lockdown and the end of the pandemic. And while there are challenges and limitations of AI, if we have an attitude of acceptance and adoption, I think there will be resources placed in order to address them. So thank you.
So thank you very much, Pooja, for that very tightly packed 10 minutes. So I'm sure there'll be lots of opportunities for questions. So can I just remind people online that there is a Q&A option available where you can type in your question, and we'll try and work through as many of those as we possibly can in the time that we have. In the best kind of tradition of these types of events, I, as the chair, was going to kick off with just one or two questions to give people in the audience time to think of their own. So the first question I had, Pooja, was you have a small startup enterprise that you're the CEO of. What are you actually working on at the minute yourself?
Yeah, so at CogniHealth, we've created a digital companion, an app called CogniCare that enables personalized dementia care. So this platform is created for carers of people with dementia, and it suggests solutions based on their individual care needs. So I guess the next question is like, how are we doing that? So we're using machine learning to develop an intelligent system that takes in consideration the available digital footprint of the user, so the care, the information about the person with dementia and their care. This includes, details about the disease and its progression, as well as care needs. So really putting carers and people with dementia at the heart of our solution. We're also using crowd analytics before making a recommendation. So really looking at other users' digital footprint and saying, okay, so what recommendations have worked in the past? And so the entire idea is kind of have a one-stop platform for dementia care. All the challenges that families could have with dementia care, we want to bring it to one place and have a personalized approach to providing support for them.
Great, thank you very much. I'm going to skip my couple of other prepared questions because we've already got quite a long list of questions on the Q&A. So I'm going to start with the first one from Paul, who's asking if there is a way to ensure that virtual assistants are giving accurate and correct responses.
So I think that kind of depends on the person or the organization creating it. What is their width of information that they're providing? So if you take the COVID-19 example that's created by IBM Watson, they probably have a set of information that they've kind of curated, and that's kind of the kind of scope of what the virtual assistant is there for. And when you have kind of a more smaller scope, it becomes a lot easier to improve the accuracy of how it replies. So what they need to take care of is understanding, how do people talk naturally? What are the different ways they can ask the same thing, and having a response that is tied to those variants in approach to asking that question. So again, keeping kind of the scope of information kind of tight in the beginning, it increases the accuracy, and they probably can learn to work with that and then expand their scope and kind of work in that way to maintain accuracy.
Okay, thank you very much. We've got a couple of questions here that are asking about affordability, in particular in relation to using robots in social care. Affordability is clearly something that's in the minds of everyone currently. And so I wondered if you could say anything about what you feel the current situation is with respect to affordability and how it might be in the near future.
I think affordability comes down to people's demand and wanting to use it, because it can, as people start building robots, they'll find a way to kind of make it cheaper and make it accessible to the larger population. But I think it starts with human behavior of wanting to use it, implement in your own home. So you always have, with a new technology that comes into the market, you'll have the early adopters who will try it out, see the benefits, the limitations of it. It kind of feeds back to the organization building it. And then when they want to scale, I think that's when you see a price drop. I mean, it happens with any new technology as simple as smartphones, in kind of the features and the functionality of it. And as they kind of grow with the market, with the demand, you can see the prices kind of trickle off and become more affordable. And so you have kind of, the really expensive ones, but I think as people start accepting it, you'll have a smaller version or smaller functionality that is cheaper, and if that is adopted, then I think we can kind of go into a market where it is affordable for a lot more people.
Okay, thank you. And there's a related sort of follow-up question here from Verena, who's asking about taxation. And she's commenting that there seems to be an idea that we need to tax AI and robots and use the money to feed back into, I guess, social care and the human elements. Do you personally think that AI products need to be taxed more?
So before speaking about tax, if we see how are we going to fund this, it kind of ties into the previous question about affordability, right? So if it's the local authorities that kind of reimburse families to adopt robots, I think that's a different conversation than the robots being adopted in a private manner. So who is kind of funding this? Where is that funding coming from? And again, having those, you kind of need the whole ecosystem of conversations to be happening for an adoption of technology. The local councils who are supporting the care providers, or who are paying the care providers based on time, if that care model changes to outcome based, that kind of influences the adoption of technology. If it's the government paying it, if it's families paying it. So I think the tax part comes in when the ecosystem is set to support the costs of that technology, including robots.
Okay, thank you. Another question, which I'm going to slightly kind of broaden out, is asking about the need to train people how to use AI and associated technology and so on. So I guess the question is, particularly in social care, where so many of us are involved, how do you feel training needs to be provided and developed so that there is if you like, a widespread uptake and acceptability of all of this technology?
So I think AI should be so seamless and so easy to access. So it should sit behind the interface. So what you really want to concentrate on is making sure that the interface is really easy and can be kind of taken up by the wider public. The AI and the algorithms and the tech kind of sits behind that. So it doesn't matter how complex that is. And a lot of times we don't, as kind of members of the public, I don't know how much we really want to understand what kind of goes on behind the scenes. It's how do we interact with the interface of the device. So if we take the Google Assistant or Alexa, for example, it's kind of driven by voice. And so, of course, there is some upskilling of care workers or some skills that the family members would require. And organizations, let's say like Alzheimer's Scotland, I know have digital sessions that, have people with dementia and their family members come in and teach them how to use an iPad or teach them how to use an Alexa. And there's initiative by other organizations as well. And so I think if we leverage kind of the support by both the charity and private sector offering that support, along with the providers or the organizations that are creating these devices to be really user friendly, then I think we're coming to a place where it's not going to be too difficult to integrate that into our lives.
Okay, thank you. Picking up on another point that you raised in your talk, you mentioned about data. So artificial intelligence and machine learning are very data hungry in some senses, and they need very good training data, because I suppose there has been some rather poor press, particularly related to things like facial recognition and some of the biases implicit in that. So I wondered if you could maybe say something more about the types of data that are needed, how we might as a society think about accessing or acquiring or even beginning to collect the necessary data, and how we manage some of those issues around concerns about bias and so on.
Yeah, so I think the first place we would need to talk about is intent. So if you want to capture a lot of this data and whether it's, for example, IoT, so you would have smart devices in people's home and use that as a way to collect data, and that will kind of help understand how preempt, acute conditions like chest infections or high blood pressure and be able to catch it early on and act upon it. That's a real use case study. Now, so the challenge would be, how do we capture that data? If we kind of, from let's say the local authority point of view, they come in and have these smart devices introduced into the family. And then the second part of that process would be, okay, so how is my data going to be used? That's the second concern. And so as long as the intent of why are we having those devices put in place? How is that data being used? If the intent is right and it's always for the person that we're looking after, then I think that kind of takes away the misuse of data. So it really kind of comes right from who is collecting the data and how is it being used, to this kind of second part in terms of, okay, now we have all of this data, how do we prevent bias from happening? So actually there was a kind of case that happened in the States where one of the systems was being biased against, Caucasian Americans versus Black Americans in the system where, it was because financially it was more used by Caucasian Americans. And so the bias wasn't built by the organization which built the system. It was more that Black Americans didn't access the system as much, and it took financial considerations. And so obviously people went back in, refigured it to just look at the condition in itself and the need based on how severe the condition was, essentially. And so I think we need to have a process in place where people test the system and really test it from different angles. So biases occur, but if we can test it in different ways, then hopefully we're kind of adding one more step before it's deployed into real life.
Sorry, this is always one of the traumas of being at home and working from home, is that the doorbell rings. So I guess one of the other questions that I have is related to this pandemic has obviously changed very much the way that many of us are living and working. Do you see that these changes are likely to be sustained going forward?
Yeah, that's a interesting question, because I think more than kind of the looking at will it happen or will it not, I think it will really improve the technology. So the flu pandemic, which happened in 1918, kind of forced the world population to go into quarantine and self-isolate, kind of like what's happening right now. And at that point, they had the same need for communication like we do today, which brought basically the adoption of the telephone in 1918. While people started using it, they found some flaws, and two physicists came in and reinvented and improved that technology. And it feels like history is kind of repeating itself. Kind of going back to the first example of the adoption of video conferencing, which now is kind of marketed as a tool to address isolation. It was initially just created for professional purposes, but just kind of a few weeks into quarantine, video conferencing tools already started to show some flaws in different aspects, which I won't go into, but it kind of shows that there is space for innovation, for improvement in the way that we interact and connect with our society, especially in a place where face-to-face meetings aren't possible. So I think human behavior is changing, and if people keep using it, that behavior will continue. But more than that, it'll be interesting to see how innovation also grows with it, because the three examples I gave, these tools have been there. These technology has been there for a really long time. It's nothing new that's really come up. The basics kind of remain the same. So I think this will kind of more focus on pushing innovation more than anything else.
Great, thank you. We've got another question coming in from John here, who's asking about the physical form of the robots for this application. I guess we're all imagining, some of the things that we've seen on television about robots and androids and other pieces of, if you like, technology. So I guess is there anything you could say about the types of physical forms of these particular pieces of supportive technology?
So, I mean, I'll give like one of the simplest ones as an example. It's to clean the floors, to vacuum the carpet. So these are they're literally circular vacuum robots. Essentially, they have enough sensors to know which direction to go in, where there's a step, where there's a fall, and they will vacuum throughout the house without anyone kind of needing to come in. And this could be interesting for people who are social distancing and keeping in their own house, but they have usually cleaners coming in to help support them to keep the house tidy. And so that could be one aspect of a physical type robot who's there to do some of those tasks which people who have health conditions can't do, but it's not kind of going into the sci-fi world of what kind of comes up when we start talking about robots.
Okay, great, thank you. I guess just to kind of begin to sort of round off some of our discussion, what other areas do you see this technology in some senses being taken up in? Whether it's within social care more specifically, or more generally in other areas of our general lives?
So I'll kind of keep it to, since we're talking about social care and healthcare. So I think one of the products that we see coming into play is telemedicine. Again, this technology was created quite some time ago, but I think what it's doing is, because it's now so widespread and it's adopted, it has a high rate of adoption. I think it's causing IoT and smart devices for home monitoring to really help people continue to live in their own homes in an independent way. So I think people kind of, especially in the area that I kind of work in, people with dementia want to stay in their own homes for as long as possible, to stay independent. And I think technology gives both the staff, the care staff, the family members, and the person with dementia kind of an access into staying independent for a longer period of time, and whether that's kind of having devices that sense falls or their movement, or basically catch patterns that are unusual from their day-to-day lives. And that kind of creeps into, can we then start predicting stuff that can happen in the future and actually intervene early enough to prevent those things from happening, and actually keeping people out of the hospital and care homes earlier than they really need to be going in there.
Great. So thank you very much. We've covered, I think, all of the questions that we've had on the forum. I wondered if there was any last few things that you wanted to say before we round up this really informative, very short webinar.
I guess I'll kind of wrap it up by kind of 3 things that maybe people would want to think about when adopting technology to deliver care. So I think one would be, how would you involve people who your service is aimed at into your plans in adopting that technology? How do you involve your staff? What information or training do they need and for their confidence in the use of that technology, and what are the risks associated with it? And finally, who will the technology affect and how will it affect them? We need to start thinking about the unintended consequences of technology. Who will it exclude from accessing it, or from people benefiting from the service? So I think if we really start thinking about it from a person-centric point of view instead of the technology in itself, that could be a different way or a good way to start looking at technology and delivering care.
Great. Well, I think that's us pretty much at the end of this webinar hosted by the Royal Society of Edinburgh. I'd like to thank once again our speaker, Pooja Jain. Thank you very much for that very insightful, as I said, very short discussion about the use of these technologies in social care. I'd like to thank all of the audience for their participation and in posting questions. I hope everyone has found this informative, and I very much would recommend the next 3 in the same series, which are being hosted by the RSE on a Tuesday afternoon. When everyone logs off, there will be a small, if you like, follow-up questionnaire just to ask about your experience of this event, and to remind you that there will be a YouTube video and a recording which will be available. So thank you very much, everyone, and thank you once again, our speaker. So goodbye.
Thank you. Bye.